All right. Now, the macrolides, large category macrolides, and then prototypic drug under the macrolides is erythromycin. Erythromycin and the macrolides, remember, these are still bacteriostatic, right? Not bactericidal. It's a broad-spectrum antibiotic. The mechanism of action is protein synthesis, just like the tetracyclines. It's frequently used. So erythromycin is frequently used if someone has a severe allergy to penicillin. Right? Erythromycin can be a second alternative to an infection that is treatable with penicillin in someone with an extreme penicillin allergy. Okay. Why would erythromycin be the alternative of choice rather than like a cephalosporin? Correct. So if the allergy is severe enough for the penicillin, we don't want to take the risk of giving a cephalosporin, because cephalosporins are still a beta-lactam antibiotic, right? And so they're similar enough that the risk for cross-allergenicity is higher. Okay? But there really is no cross-allergenicity between penicillin and erythromycin. It's active against most gram-positives and some gram-negatives, which is actually the same profile as penicillin. Yes, ma'am. I'm sorry, say that one more time. Oh, that's a good question. So, I don't know. That's a good question. Can be bactericidal. I will let you know. But my guess is probably a dose-dependent administration, but I will let you know. Thank you for that question. Okay. So erythromycin is used against whooping cough, which unfortunately is quite common lately, acute diphtheria, and chlamydial infections, group A strep pyogens, and M. pneumoniae. Can be used as an alternative to penicillin G in patients with penicillin allergies. Drug interactions. So it is a enzyme inhibitor, a liver enzyme inhibitor, and so it will increase levels of drugs like theophylline, carbamazepine, and warfarin. Okay. Theophylline is a drug that is used for respiratory diseases like asthma. Carbamazepine is an anti-epileptic drug, and warfarin is an anticoagulant. Okay. And all of those drugs do have some pretty serious adverse effects with higher doses. And so we want to avoid combining erythromycin and those drugs because of that interaction. Adverse effects, it causes GI upset. It can prolong the QT interval. It can cause sudden cardiac death as a result of dysrhythmia. And it can cause superinfections, okay, thrombophlebitis, and transient hearing loss. Okay, so there is a certain degree of ototoxicity. So erythromycin is bactericidal at high concentrations. So that was just to let you know. So it was a dose-dependent. I'm sorry? Yes, yes. The macrolides are officially bacteriostatic, but then at high concentrations can be bactericidal. Okay. And linozolid is used to treat VRE, which we actually will talk about linozolid in a minute. Yeah. Okay. Okay, so we're going to talk now about clindamycin and another drug that also ends in mycin. Now, clindamycin, so not all drugs that end in mycin are the same, right? Which is confusing. It's like they changed the rules midstream. So vancomycin, for example, is not a macrolide, even though it has a similar suffix. Vancomycin actually is its own category. It's a completely chemically different drug. And erythromycin is a macrolide. And another very famous macrolide is azithromycin, right, or the Z-Pax, right? That's very, very common. Those are macrolides. Clindamycin and the next one I'm going to talk about, they are not chemically similar to erythromycin and the macrolides, but they often compete for the same targets. Okay? So they have similar mechanisms of action, but they're not the same kind of drug. That's right, not a macrolide. And so this is kind of why these antibiotics are often categorized by mechanism of action or susceptible organism, because the chemical classes are more fluid, right? It's less easy to divide them up in terms of chemical classes, but it's easier to divide them up in terms of their mechanism of action and their susceptible organisms. So clindamycin, also bacteriostatic, inhibitor of protein synthesis. And like the tetracyclines that we looked at, can promote C. diff, okay? Or something called Clostridium difficile associated diarrhea, or CDAD. And C. diff really can occur as a result of any antibiotic treatment where the gut bacteria are affected. But there are some antibiotics where the risk is a little higher. Okay? And the clindamycin happens to be one of those. So any appearance of diarrhea while on clindamycin needs to be treated with care. And C. diff needs to be ruled out. So it's active against most anaerobic bacteria, gram-positive and gram-negative, and it's indicated really only for certain anaerobic infections that are outside the central nervous system. And it's usually used as an alternative to penicillin. Now, clindamycin, in addition to increasing the risk for C. diff, is also hepatotoxic. It also can cause a change in cell numbers in the blood. That's what the blood dyscrasis is. It's when either the white blood cell count goes down, or platelets go down, or red blood cells go down. Okay? It's an abnormality of cell counts. Diarrhea, other than C. diff, diarrhea is also an adverse effect. And we can also have hypersensitivity or allergies to clindamycin. Yes, ma'am. This one? Yeah. Um, yeah, even when a drug it is active against a broad variety of microorganisms, it doesn't mean it's the safest drug to treat those infections. Do you know what I mean? So clindamycin can be used instead of penicillin to treat certain infections. But if you don't have any allergies to penicillin, penicillin's a much safer alternative. So clindamycin is like erythromycin is frequently a second option, right? But there are certain infections, anaerobic infections outside of the central nervous system, where clindamycin might be your first line drug. That make sense? Okay, so linozolid, which is that drug that's used to treat vancomycin-resistant enterococci, is the first member of a newer class of antibiotics that are called oxazolinidones. And so that's the chemical class. Oxazolinidones is the chemical class. Okay? And these are drugs that they're fairly new, and they have become a next resort, right, to drugs that are infections that are resistant to our last resort group. So it's active against MRSA, it's active against vancomycin-resistant enterococci, and many other highly resistant organisms. Okay? And so obviously it's a drug that's used with great precaution, because the more we use it, the more likely resistance to it will develop. It is a bacteriostatic inhibitor of protein synthesis, and there are some cross-resistance with other agents. Excuse me, cross-resistance with other agents are very unlikely. Okay, so antibiotics where it's developed resistance, linozolid will still likely be very active. Okay? So it's active against aerobic organisms and facultative gram-positive bacteria, meaning that these are either organisms that require oxygen for their metabolism or can use oxygen for their metabolism. Okay? Common side effects, most common side effects, diarrhea, nausea and vomiting, headache, which are probably the most common side effects for most medications. It can cause Milo suppression. Milo suppression refers to suppression of the myeloid-derived blood-borne cells. And so if you remember, the myeloid-derived blood-borne cells are numerous, right? They included red blood cells, most white blood cells except for the lymphocytes, platelets, right? And so those are a lot of blood cells. So myelosuppression will definitely increase the risk of things like anemia and infection. We also see drug interactions with monoamine oxidase inhibitors. And monoamine oxidase inhibitors have a wide variety of applications, including as a antidepressant, but it's very rarely used anymore because there's so much interaction. But linozolid itself, the drug itself, is a mild inhibitor of MAO, which can increase the risk for hypertensive crisis. Okay? Monoamine oxidase is an enzyme that breaks down chemicals like catecholamines. And so when you block MAO, you increase the half-life of things like epinephrine and norepinephrine, which can increase the risk for hypertensive crisis. Telethromycin. Telethromycin is a first member of what's called a ketolide class of antibiotics. It's a close relative to erythromycin and other macrolides. So it's chemically similar to the macrolides, okay? But it's a fairly new drug. It is effective against strains of Strep pneumoniae. Okay? However, it carries with it some pretty severe risks. So adverse effects can be severe liver injury, GI effects, visual disturbances, and prolonged QT interval. Okay? I'll mention also with Linozolid. Linozolid has become this like new go-to drug for very persistently resistant infections, including very scary is multiple drug-resistant tuberculosis, okay? Which the numbers of that condition are actually increasing worldwide. So Linozolid has become another option for treating drug-resistant tuberculosis. So hopefully you're noticing that as we get more and more potent in the spectrum of antibiotics, we're also getting more and more toxicity. Okay? And so we start to really, make these difficult decisions between you have to treat an infection, but also when you get an infection with somebody who has severe liver impairment or kidney impairment, okay, it can really worsen that condition. But you still may use the drug anyway, okay, because it's like which fire is the most life-threatening and urgent.